Hi, my name's Louise Frampton. I'm the editor of Clinical Services Journal. I'm joined by John Sandham, who's the chair of EBME. So John, another great lineup of speakers again this year, and the event's just gone from strength to strength. But we've seen some changes in recent years, haven't we? You've brought together theatres, procurement, training elements all under one roof. So why is it important to bring all of those together, do you think?
Well, I think looking back over my career, which spans 35 years, when I first started in this job, it was about repairing and carrying out plant maintenance of individual devices. Now you're looking at whole systems of technology that not only work inside a hospital, but work outside the hospital. So you're looking at medical equipment in a patient's home, for example, that needs to be connected to the consultant via Bluetooth, via Wi-Fi, and that information needs to be transmitted in a cyber secure way back to the consultant so that the consultant can look after that patient in their home. And there's more and more of this happening. You'll see it in the news all the time. So to do that, you need the procurement people working with the users and the EBME people to specify the right equipment, to specify the right IT. And so we need a more joined up approach, and I think to do that, to have that joined up approach and to share that knowledge in the actual exhibition and conference area, you've got all those people mingling, networking, talking to each other, and also talking to the suppliers, because they're also an important part of this jigsaw. You've got things like Health Level 7 software, which is now inside all the equipment, which helps with data communication, but then you also need normal communication between the users, the buyers, and the maintainers.
Right, okay, that makes a lot of sense. So what are some of the really hot topics that are going to be discussed at EBME this week? What's really top of the agenda at the moment in the clinical engineering sector?
Well, I think looking forward, the way that things are going is data from devices will be going into the electronic patient record. And you've seen in the news recently around cyber security, around people hacking into NHS systems.
Absolutely.
And I think that is actually top of the agenda on more than one of the stages over the next couple of days. Cyber security is so important. I just mentioned HL7, Health Level 7 software, which is inside most electronic medical equipment now.
Right.
You need to make sure that that data is secure coming out, but also that people can't get into the equipment, because God forbid that somebody would go and change the settings on a device that's connected to a patient. Now, I mean, that sounds like science fiction, but actually it could be a reality. So we need to make sure that everybody is aware of cyber security, and that's another medical device, if you like, software to protect the equipment and ultimately to protect the patient.
So what do clinical engineers need to really understand about that, and what can they learn over the next couple of days, do you think, or sort of take-home messages, do you think?
I mean, I'm doing a presentation. In my presentation I'll talk about cyber security, and I think that many of the others, I've seen all the presentations, and many of the other presentations also talk about cyber security amongst other things. So I think they'll learn a lot about which companies are available to help them with cyber security, what to look for when they're buying. Well, it's not just equipment, but also software in terms of cyber security, because we're all entitled to our data to be protected, whether that's health data in a machine or whether that's our personal data. And we've seen recently, even outside healthcare, a company like Santander Bank, who have had millions of records stolen. It's something that's important globally, not just in the healthcare sort of sector. So I think they'll learn a lot about that. They'll go away, they'll understand that they need to know more about it and hopefully do something about it. The whole of this conference is about learning and about understanding what's coming next. I think we need to be looking forward. I mean, sometimes it's good to look back as well. One of the things that I was looking at only yesterday was the 2014 paper that was published saying the 5-year forward view. And it talked about investment in the NHS and how they were going to use technology to improve the NHS and how that would impact on waiting lists. And 10 years on, that conversation is still happening. And I think that conversation is still happening because the NHS spends less than 4% of its budget on technology. And if you look at companies like Toyota or big car manufacturers, they spend a significant amount of money on technology to make them more efficient. Now I know that manufacturing is different to healthcare, but at the end of the day, we use machines that do a specific job, that use software, and we use data management systems, and so do manufacturers. And yet some manufacturers will spend up to 40 to 50% of their operating budget on technology, and the surrounding parts that you use around technology. And the NHS spends about 11.4 billion in the last year out of a nearly 300 billion budget, so not a lot. And if you want to become efficient, like they said in 2014, in the forward view in 2014, you've got to use technology. But to be able to use that technology, you've got to have the investment, and that's missing at the moment. There's not enough going in.
So we've touched on cyber security. Another really big issue on the programme is sustainability. So what are some of the things that clinical engineers can do to really drive that agenda forward and to help the NHS achieve its ambitions around net zero?
So there are lots of things around sustainability that EBME clinical engineers can do around the longevity of a device. If they can keep a device going, if it's still current in terms of the clinical practice, then, and they can keep it going through good maintenance practice, then that helps with the circular economy, in that you're not constantly buying, replacing. I think manufacturers can also do something in terms of helping with that, because there are lots of devices which don't need the casement effectively to be replaced. They can be updated just in terms of software. And this can be from small devices to very large devices such as MRIs or CT scanners. They could design the equipment, and this is happening more now, so that actually they don't need to replace the whole device, they only need to update the software. And then maybe replace some spare parts as part of the planned maintenance procedure. And the EBME teams can work with the manufacturers to better understand and better develop that sort of more circular economy, rather than the linear way that we tended to buy devices in the past.
So another big issue that's been on the programme over the last few years is around the virtual ward. So that's being rolled out increasingly across the community sector. So in terms of how you manage that from a medtech perspective, what do clinical engineers need to really understand to ensure that that we do this efficiently, that assets are managed and maintained, and that patient safety is ensured at all times? What's your sort of thoughts on that?
I think when they're buying devices, they need to buy devices that are secure, again going back to the cyber security, but also they have good capability in terms of communication. You have some devices which have sort of more open communication, and some devices are more bespoke to certain or specific companies. If you buy something that's bespoke to a specific company, without mentioning any company names, then you end up having to buy all of their devices in that whole chain of communication from the patient in their home back to the consultant in the hospital. If you buy more generic equipment that is HL7 compliant, you can then have more choice. And I think that's where the EBME teams can come in, working with the clinicians and with the procurement teams to have a more joined up approach and helping the patient to stay at home. Training is also a vital part of this. We don't have enough user trainers for the community. I think one of the vital things that every EBME department needs to do is to make sure that if they're involved in hospital at home projects, they also have somebody that's going into that home, or they work with somebody. It could be a clinician, or it could be a specialist trainer from the manufacturer, to make sure that the users in their homes absolutely understand how to use the devices that they've been given.
So another area that you're heavily involved in is the charitable sector, and EBME Expo's got a really long history of supporting some great causes. So I wonder if you could tell us a little bit about why that's so important to you, and also some of the causes that clinical engineers can get involved with.
I think I'm personally involved with two charities, My Bridge International and the Amalthea Trust. But there are other charities that are here, Mercy Ships being one of them. We have a speaker that is talking about operating on Mercy Ships. I think charities are really important because we need to be aware that we are a rich country and there are a lot of poor countries that don't have what we have. So that's why I always bring the charities in. I always ask them to do a little talk. Some of them want volunteers. So the Amalthea Trust, they want volunteers to go to Africa and train engineers in Africa. MyBridge International is developing or has developed a software which allows people to communicate so they can share knowledge. Pretty much what we're doing here, having an event where you have different professions and different people coming together to try and learn from each other, and that's what MyBridge International is trying to do. Mercy Ships, they go around the world and they operate on patients who otherwise wouldn't be able to have those operations, and I think that's really important for us to share our knowledge, but also volunteer if we're able to volunteer. So I give my time to try and help these charities as much as I can, and I think that's what a lot of other people want to do. So it's more of like an introduction. Again, it's a networking opportunity for those charities.
Excellent. Now, another thing that's really important on the programme is that each year you celebrate the Paul Austin Clinical Engineering Apprentice of the Year Award. So I wonder if you could tell us a little bit about that award and why that's so important as well.
Paul Austin was a clinical engineer, and as a tribute to him, MTS Health, with myself and some other people, set up the Paul Austin Award to recognise that the company that he was working with, his company, had a lot of apprentices that they were bringing on, and we wanted to expand that and have an opportunity for apprentices to do well. Apprentices are really important in the EBME profession, in fact in all professions, because it's a way of getting into work. If you haven't got A-levels, for example, and you can't get into university, then apprenticeship is a good alternative route. Also, we've got an ageing profession in EBME, and we need more young blood. We need more young people being interested in this profession. And from what we were just discussing, it's such a wide and varied field, healthcare technology, from cybersecurity to MRIs. It could be anything in between. But there's lots of opportunity, and it's very, very interesting as well. So I think the Paul Austin Apprentice of the Year Award is about rewarding apprentices who have worked hard, achieved something within what they're learning, and be recognised for it. So I sort of look at these people who are up on stage receiving the Apprentice Award as maybe our managers of the future, our innovators of the future. Maybe in 35 years they'll be sat here doing a similar interview and saying, yeah, I remember getting my Apprentice of the Year Award at the EBME Expo. Fingers crossed.
Fantastic, it's really inspiring. I mean, what can we do to really nurture that talent, do you think, and encourage people into this as a profession? Where do we need to start, really? Does it go back to primary schools and getting that message out there that these are options?
I think I would start with there's a government responsibility. The government doesn't do enough in terms of healthcare technology and providing support. I think there could be innovation awards at a government level for, we're doing the Apprentice of the Year Award. There's no reason why there couldn't be some sort of government scheme that rewards people for coming into engineering, coming into medical engineering, and does so. There's a government push, government funding for students who want to come into medical engineering. It's a difficult subject. It's often engineering is, I would say, not sexy in terms of going to university. But actually, once you get into it, it's really interesting, but it's hard. So offering student grants is something the government could do. But yeah, at schools as well, STEM. So, getting kids interested in maths and science early, those are the people who really are going to come into engineering. So it could be a two-pronged approach. We do what we can do, people in our profession, to get people interested. Working with students in university. So I've been working with Cardiff University, Birmingham University and Warwick University, giving lectures to students and helping students with their projects. I've had some undergraduate, some postgraduate students under my wing, which I do free of charge. You know, it's voluntary, and there could be more people like me out there who are interested in offering their time in a voluntary way to help students to do better in this industry. I think there are probably other things I haven't thought about off the top of my head, but those are the sort of focal points that I would have.
Excellent. Well, it's certainly a career that I'll be recommending to my son, so watch this space. So it's an election year, and what message would you like to give the future government on how we can make clinical engineering sector fit for the future? What's your thoughts?
Well, I often go to meetings where there are promises made by politicians, and I've often challenged politicians on their promises. And I think one of the promises that's been made, I said the 5-year forward view from 2014, 10 years ago, promised that technology was going to be used to improve healthcare, and it has to a certain degree. You know, there have been projects here and projects there, but it hasn't had the impact that the government said it would have. Now, even with Hospital at Home, which we just discussed, it hasn't had the impact there either. And I think also there are opportunities around step-down care, where you could use technology. If they can't go home, you could move them into a different location and use technology to support that. So I think the investment needs to come. When I do my presentation day after tomorrow, that I'm going to be talking about that. The government doesn't invest in a way that technology will really have the big impact they want it to have. So the penny pinching is having a negative impact in terms of bringing in technology. I've worked on hundreds of projects where the projects have been turned down because of a lack of funding, and that's because there's a lack of strategic intent at a government level. They tend to think year to year. NHS hospitals get budgeted year to year, and if they can't do a project within a year, then they tend to get scrapped. And you need to be looking. They talked about having a 5-year plan. It didn't work, and 10 years on, they're still talking about the same things they talked about 10 years ago, and they need to get the right team together to push it forward and actually put the right amount of money behind it to make it happen.
Absolutely. Some really interesting comments there. Thanks for giving up your time today.
You're very welcome.
Really looking forward to the rest of the event, particularly to your presentation. I'm sure it will give people lots to think about.
Thank you very much.
Thanks.